So I'll be talking about medical diseases often ignored, which is really a bit of a misnomer. I think we all can and should be able to recognize medical diseases of the spine. It's not quite as sexy as some of the other things we talk about, but to be a well-rounded pain specialist, I think this is important. I have a small disclosure not relevant to this talk. So diseases often ignored, also known as talking about all the other problems with the spine that we don't normally talk about in 15 minutes or less. So I'm going to be going through this pretty quickly. So we're all used to the structural and neuropathic causes that we like to focus our time on. The structural causes that we can focus our procedures, our interventions, our corrections, and also the neuropathic causes that we like to neuromodulate or perform various regenerative techniques. But let's talk about some of these other causes that don't quite fit into